Hi, I'm Darcy, one of the pharmacists at Red Cross Drug. I'd like to thank you for attending this Wellness 101 on hormones. I hope that it helps you live a healthier life. I'd like to start out by identifying the term bioidentical hormones. It means that the chemical structure of the replacement hormone is identical to that of the hormone that exists intrinsically in the human body. When we think about our goals of balancing hormones, the secondary goal is to help you feel better symptom-wise. The primary goal is to protect various body systems. By balancing your hormones, we can actually improve cardiovascular markers. We can help with making the lipid profile reflect more positively, lower blood pressure. We can help maintain the nervous system, help strengthen the immune system, help strengthen bones and muscles, and improve eyes, skin, hair, and nail health. And secondarily, we can help you feel better with your symptoms. What are some symptoms of menopause? I'm sure you're very familiar with most of these. If you'd like, you can pause the computer and look at these more closely, as well as symptoms for men of andropause. What is the difference of conventional hormone therapy versus bioidentical hormone therapy? The literature gets very confused in these two different worlds. Conventional hormones are typically hormones that are synthetic and modified from the natural structure that exists in our body. Marketing versus opinion versus fact. Drug manufacturers have done a really good job of educating our healthcare system on the benefits of synthetic hormones. And due to that, a lot of times our healthcare practitioners are giving advice based on the marketing of drug manufacturers. It's just a simple truth of what happens in our system. There's actually a lot of health benefits to maintaining levels of bioidentical hormones versus the risks that are associated with synthetic hormones. And what areas do we want to treat? We'll actually touch on all of this a little bit during this lecture today. The effects in the body are proven benefits and effects when we talk about bioidentical hormones. So just looking at the structure of the actual natural hormones that exist in our body, these are the three estrogens that we do carry: estrone, or E1, estradiol, or E2, and estriol, or E3. When you look at these different hormones, they look very, very similar. You can see estradiol has a hydrogen added instead of a double bond, but kind of a simple little change there. And then the estriol actually has an additional hydroxy group added to the molecule, but very small changes in the big scheme of things. And it's really amazing to think that estrone is 10 times more proliferative in the uterus than estriol, and estradiol is 10 times more proliferative in the uterus than estrone. So when you compare those two on the right, the estradiol and the estriol, just adding that little hydroxy group makes or by taking away the hydroxy group on estradiol, it makes it 10 times more, or 100 times more proliferative in the uterus than the structure on the right. It's amazing that such a small change can have such a big effect in the body. And then just a point of interest is how similar testosterone is to those. And when we look at this chart, it just below places some of the synthetic estrogens available on the market. And you can look at the structural differences there and sometimes see very dramatic differences. When you look at that, it's pretty obvious to think these are not going to behave in our body in the exact same way that the natural hormones do. This is a chart that compares some of the synthetic progestins versus naturally occurring progesterone that is in our body, or bioidentical progesterone. Here you can see very, very large differences with the molecular structure, and it's really common in the media for progestins to get linked all together, and it's important to understand that progesterone is different from progestins. This is a look at a normal menstrual cycle for a female. It shows the estrogen peaking in the middle and then tapering off a little bit as the progesterone is spiking at the end to help balance out the proliferative effects of the estrogen. The two hormones are very important to balance each other out, and you can just see everything that's going on during that 28-day cycle. What are the functions of estrogen? It protects the heart and blood vessels, prevents bone loss, maintains brain function, so it helps to prevent memory disorders. It helps maintain the central nervous system, maintains structures and functions of the skin, mouth, and eye, and helps maintain normal weight. Progesterone is present in every human regardless of age and has receptors in almost every cell of the body. Once again, reflecting back to what the media and some of the education that's out there, it really focuses on hormones in the bikini zone. And this is an important point here that progesterone has receptors on almost every cell of the entire body. So it is not simply important in the bikini zone. It acts on the uterus and breasts, but also on the brain, smooth muscles, kidneys, bones, cellular membranes, and progesterone is metabolized to other active hormones. This is the pathway of how our hormones are made. It's an interesting pathway to learn. You can see that everything actually starts from cholesterol. So it is important to have a normal cholesterol level in order to have enough of the building blocks to make our hormones. And if you want to pause, you can look at this slide a little more closely, but down on the bottom in the middle, you can see the two estrogens, estrone and estradiol. They're able to freely convert back and forth at any time based on body needs. What are the effects of progesterone? It helps to balance the actions of estrogen. That's one of its most important actions. Every kind of cancer out there, most every kind of cancer out there has estradiol receptors, and the estradiol helps the cancer proliferate because estradiol is really good at causing cell proliferation. So progesterone helps balance out that proliferative effect. It's important to have the two together. Progesterone acts as a natural diuretic. It normalizes blood clotting. It helps with osteoporosis because it stimulates osteoblast-mediated new bone formation, and it protects the central nervous system and maintenance of anti-aging mechanisms. It's important to point out medroxyprogesterone acetate is one of the most common synthetic progestins that we see on the market. It is not the same as natural or bioidentical progesterone. Medroxyprogesterone acetate only imitates progesterone in the uterus, where it helps prevent proliferation. Everywhere else in the body, it produces nearly the opposite effect of natural progesterone, such as MPA increases the risk of breast cancer, anxiety, and depression, and natural progesterone decreases the risk of nearly every kind of breast cancer. We have some great documentation on that if you'd like to see it. It also helps prevent anxiety and depression. This is the molecular difference in those two hormones, and as you can see, there is a very significant difference in the actual structure of the two hormones. What are the benefits of testosterone? It helps maintain sexual interest and response. It increases a sense of emotional well-being, helps maintain neurotransmitter balance, and helps maintain memory. It maintains lean body mass, muscle strength, and stamina. It provides cardiovascular protection, helps maintain bone strength, and helps maintain skin and hair health, and quality of life is improved. I also like to point out that there's a lot of data out there showing that too much testosterone does not do these things. It may actually have some of the opposite effects. So we really focus on actually replacing physiologic levels of that hormone and all hormones. DHEA is a precursor to other active hormones. We used to think that was the only role it had, which was a very important role, but now we're discovering that it has a lot of other effects in the body, protecting the immune system. It can be used to treat osteoporosis, to prevent erectile dysfunction, to help with vaginal dryness, improve mood, and improve memory. This is just a little bit of light humor here that the pharmacist is explaining. They're synthetic hormones for menopause. Side effects include artificial hot flashes, fake mood swings, and imitation night sweats. Hormone imbalance is associated with every major disease that plagues Western society. The big ones such as cancer, cardiovascular disease, osteoporosis, and diabetes all are associated with hormone imbalance. This is a look at the different estradiol and progesterone levels over a lifetime. You can see during puberty and perimenopause, estrogen is peaking and troughing rather erratically. It can be kind of a tough phase to test estrogen levels, but it can still be beneficial. And then you can see as we enter menopause, yes, estrogen levels do decline, not nearly as significantly as progesterone levels do. Oftentimes we can help you feel a lot better just by replacing progesterone alone. It's interesting to note, we just put up a slide here for breast cancer incidence, and it is exactly opposite of progesterone levels. It has been proven that the more a woman is pregnant, her breast cancer risk is decreased, and it's well known that progesterone levels really go dramatically up during every pregnancy. So it's very protective of breast cancer to maintain progesterone levels. So bioidentical physiologic hormone restoration therapy. Our objective is to restore the hormone levels to the normal physiological level of a younger individual to provide the protective benefits of the hormones to your entire body. Once again, normal levels, which require testing so that we don't replace too much hormone. So bioidentical hormones, the chemical structure must match that of the original hormone naturally produced and present in the body in order to fully replicate all the functions of the hormone throughout the entire body. It's also important to note that hormones can be very helpful, but they are all just a part of the whole puzzle that is our body. Cortisol and thyroid are the king and queen of the sex steroids. So we never want to just simply look at this one little picture of your health. We want to look at the whole picture. Restoration therapy, we would establish the need through testing and symptom evaluation to see if there is even a need for hormones. We would also try to look at correcting any underlying problems such as diet, exercise, or nutrition. And then we could replace hormones if needed and monitor symptoms and retest. So how to get started? We do have a book that is very good about talking about not only the hormones but the lifestyle things that we were just alluding to. You can check it out for free at Red Cross. It's called Hormone Harmony from Dr. Alicia Stanton. After we identify those lifestyle things, we can do a hormone evaluation to see if there is a need, and then we can continue to measure the hormones. I'd like to thank you for listening. If you feel like we could help you with this area of your life, I hope you'll stop by and ask one of our pharmacists about it. We would love to help you live a healthier life.